This has been a useful debate, sir. The government is embarking upon a program to transform and reform many things in the society. And members of the House are going to be called upon to speak to, vote for, or amend or against many, many changes. We're behind. We're behind in advancing this society of ours. You know, Mr. Speaker, it is unbelievable that 37 years after independence, we don't have a national museum. It's just unbelievable. That 37 years after independence, we still have Supreme Court premises that used to cater to 4 judges. We now got 12 judges. But we still have adequate criminal laws on our books and procedures, things which the British have abolished 50, 60 years ago. Consumer protection is lacking. And the list goes on and on and on. Notwithstanding that, Mr. Speaker, we will press on and do the best we can in the shortest possible time. I wanted to respond, Mr. Speaker, to the member for Bain and Grandstown about the question of a commitment to national health insurance. Speaking for myself, I always put my money with my mouth. I became Minister of Housing and National Insurance in June of 1982. And in those days, each ministry sent forward to the Cabinet Office what it wanted to accomplish in that session. And of course, one of my objectives at the time was a national health insurance for the Bahamas, an objective which the Prime Minister at the time also shared. And the speech from the throne in August of 1982 permitted the government of the Bahamas to do this. Quote, develop an innovative medical and hospital insurance plan in conjunction with Ministry of Health, etc., etc. By December of the following year, I had written a paper headed Health Insurance. I'll read it. It's 17 years ago. There's a need to improve the efficiency of the present healthcare system and to provide medical services at cost that are affordable to contributors and or other dependents. In this regard, and consistent with the government's goals as stipulated in the speech from the throne, we propose to provide an efficient, affordable, and effective system of Medicare in the Bahamas. He went further. Came to the House 27 years ago. Well, that's even worse. Went further. Came to the House in May of 1984 to amend the law, to amend the title of the National Insurance Act, so that the new title of the National Insurance Act would include the following. An act to establish a system of national insurance providing pecuniary payments in respect of sickness, invalidity, maternity, retirement, death, industrial injury and disablement from industrial injury, medical care, and of social assistance for insured and other persons in the Bahamas. I never thought that it was ever necessary for any new law to be brought to the House of Assembly for any government that wanted to introduce national health insurance. The National Insurance Act has for 27 years contained such a power if a government wished to do so. We committed, Mr. Speaker, that we would first of all begin with a national prescription drug benefit program, which begins next week. And when I spoke on the 21st of this month, only 11 pharmacies in the Bahamas had at that time agreed to participate in the program. 22nd. I'm now pleased to announce, Mr. Speaker, that another 30, well, a substantial number of new pharmacies have now agreed. And so I want to read, for the benefit of the public that listen to me, all the pharmacies in the Bahamas that have now committed to being a party to the program beginning next week. This is the list I gave last week, Mr. Speaker. Lowe's Pharmacy, Bataan Pharmacy, the People's Pharmacy, Wilmark's Pharmacy, Centerville Pharmacy, Doctors Hospital, LMR Drugs in Grand Bahama, Healthy Springs Pharmacy, and Smitty's Pharmacy in Exuma. These are the new pharmacies that have committed today to participate as of next week, Tuesday, in the program. Haven Scent Pharmacy, QBS Pharmacy, the Community Pharmacy, Oliver's Pharmacy, Infinity Pharmacy, Sabre Pharmacy, Your Friendly Pharmacy, Total Therapy Pharmacy, Family Pharmacy, McCartney's Pharmacy, Island Pharmacy, the Prescription Center, the Prescription Parlor Pharmacy, Doc's Pharmacy, Paradise Pharmacy, Chappie's Pharmacy and Drugs, Sunrise Medical Center, Apple Tree, Sunrise Medical Center and Apple Tree, and NYO's Pharmacy, and Lucayan Medical Center, and St. Jude's Medical Center, and Save More Drugs are all in Grand Bahama, in Abaco, Abaco Island Pharmacy, and the Chemist Shop, both in Abaco, and of course Long Island Prescription Center in Long Island. Not participating yet, Mr. Speaker, is the pharmacy in Long Island. I tried to get, in Spanish Wells, I tried to get Abner Pinda on the phone just now, my general in Spanish Wells, to ask him to make sure that Spanish Wells participate in the program. He just heard me.
He got the message. Got the message.
He just heard me.
Where you going?
He just heard me. And so, Mr. Speaker, I'm very pleased that all of these pharmacies have agreed to participate. I might say that there needed to be some additional sweetener in the pot to persuade some of them, but it was a doable proposition, and now it's going to be easier and more convenient for larger numbers of Bahamians to participate and obtain their prescription drugs. I also, Mr. Speaker, want to, in response to the member for Foxhill, not response to him, but one of the points he made, and say that in addition to pensions being adjusted automatically every 2 years, the maternity grant will be adjusted every 2 years automatically, as will the funeral benefit grant be adjusted every 2 years automatically, commencing this year, so that the funeral grant will now go to $1,600 instead of $1,500, and the maternity grant will go up by another $27. And every 2 years, they will be amended. They will be adjusted automatically. Also, Mr. Speaker, I'm going to table for the benefit of members what the likely impact. I may not table it today, but I will make available to members what the impact is going to be with respect to a civil servant's pension once the new ceiling goes into effect and the amount which they will collect as a result of it. It will be a substantial increase in benefit. Mr. Speaker, from our point of view, we don't need to argue over who does what. I was not very well known in Nassau. I came from the island. I became Minister of National Insurance, and I was that for 2 years. And my name became known far and wide throughout the Bahamas. What I am today, my service there helped to make me. What I am today. No, housing and the rest of it, and all the things I did politically. All the things I did politically. And so, I don't need to try to convince anybody in the Bahamas that, like the good book says, the little talent I had, I did not bury. I went and multiplied my talents. I don't have excuses as to what I didn't do, etc. Every day of my life, I seek to do all I can. And I sleep well, because I know I did all I could today. And tomorrow, I begin again. And when I'm out of office, I am unconcerned about what people say I did or didn't do, because I know I did my best. I will always do my best.
That's why you're simply the best.
I will always do my best. And so, Mr. Speaker, with those brief words, I wish to move a resolution for the increase in the benefits of national insurance.